You are now listening to the Lunch and Learn with Dr. Barry. This is episode number 24.
Thanks for listening to the Lunch and Learn with Dr. Barry, here to help educate, motivate, and put you on the right path to take control of your health through weekly discussions on topics in the medical field, public health arena, and in your community. And now your host, Dr. Barry.
Welcome to the Lunch and Learn with Dr. Barry. Today we're going to be talking about cigarettes and heart disease and why it's a deadly combination. And like always, if you want show notes, please go to drpierresblog.com/LLP024. Again, if you want show notes, please go to drpierresblog.com/LLP024. And on today's Lunch and Learn, we're going to be talking about who's doing all of the cigarette smoking. We're going to be giving you some facts, some figures. You're going to hear my take on cigarette smokers. I'm going to give you some risk factors that occur when you add smoking cigarettes along with heart disease. I'm going to give you some tips to quit smoking. I'm going to answer a few questions on vaping because there's been some talk that vaping may be better than cigarette smoking. And we'll be talking about the risk factors for that. So stay tuned and get ready for another great episode. So today we're talking about cigarette smoking, and I just want to we're gonna go through a couple, some big factors associated with cigarette smoking and heart disease specifically, because it's so prevalent. Unfortunately, we talked about it. Heart disease in our previous episode 16. As far as all of the risk factors kind of associated with that. And, now I wanted to kind of touch back on smoking in particular, because smoking is one of these risk factors that we can actually change. When we discuss heart disease, we talked about things that really can't change in terms of, family history, history of cholesterol, history of all these things here. But smoking is one of those things we definitely can change. Oh, Josh, how's it going? Appreciate you for joining the live. Dr. Berg, our good pediatrician friend of mine from medical school as well. So let's talk about cigarette smoking, right? Let's just give it some raw facts, right? It has been shown to be the most, and no side stress, is the most preventable cause of death in the United States, and really worldwide, but at least in the United States, the most preventative cause is smoking, right? So, if we could just get people to stop smoking, we know that we can extrapolate the amount of deaths that we would save. And from a worldwide perspective, we know smoking is a cause for about 6 million deaths worldwide. 6 million deaths worldwide is attributed to just smoking alone. In the U.S., I think it's about 2.4 million, but about 6 million deaths worldwide can literally blame right on the smoking. So definitely something that needs to, we need to address. And the reason why smoking cigarettes is so bad for us, right? Because we know, especially from a medical standpoint, we know cigarette smoking affects nearly every organ in the body. Like there's almost not a single organ that's not affected by cigarette smoking. And the reason why that's concerned is because it affects almost every single organ. The risk for cancer, for a person who smokes, increases dramatically. If you're a smoker, you are more likely to get lung cancer. If you're a smoker, you're more likely to get bladder cancer, brain cancer, colon cancer. And from a medicine standpoint, my medical students who are watching this understand and know, if there's a test question that says, what's the one thing I could change in this person to kind of help, prolong life? If cigarette smoking is an option, it's 100% going to be the answer every single time. There's literally never, ever going to be a reason why cigarette smoking is not going to be a cause. So definitely something that we try to stress. And again, I know physicians, especially the ones who have the time, we definitely try to, stress, getting off their cigarette. But it's the reason why is because we know, again, you may be, and we're going to talk about the people who, are more likely to smoke and, which gender is more likely to smoke and everything from a cigarette standpoint. But we know the risk factors are there. We know that, just me talking to you, every time you come to see me for an appointment is a much higher chance of you actually quitting smoking than if I never, especially the doctors, if I never say anything, the likelihood of you wanting to quit smoking is going to be very low. So definitely important, especially from a medical standpoint. I'm a physician, but also from, my public health hat. My public health hat as well, definitely important to, stop the cigarette smoking, right? So let's talk about like how. So the how of the cigarette smoking. We know cigarette smoking does several things in our body. We know because of the amount of chemicals that are in the cigarette smoking. We know that it causes an increase in blood pressure. We know it causes an increase in heart rate. We know it causes an increase in chemicals that stimulate stress, which again causes our heart to have to work much harder to do its normal job. We know that when cigarette smoking, attaches to our red blood cells. Hey, Marnita, thank you for joining. We're talking about cigarette smoking and heart disease this month. We know that just smoking cigarettes is enough to, when it starts binding on those red blood cells, that it becomes less likely to be able to carry oxygen. So my cigarette smokers, and you see these now. You'll see these commercials where people who are on chronic oxygen. A lot of times, cigarette smoking is a big factor in that. Again, like I said, remember, cigarette smoking touches every organ in the body. So, of course, it's going to affect the lung as well. We know cigarette smoking, if we just focus on the heart, causes an increase in plaque buildup. A lot of times we think, high cholesterol is why our plaque builds. But no, cigarette smoking is definitely a big factor there. Not very people that many want to stop. Now, very good point, and we're definitely gonna talk about that, Amanda. As far as the fact that cigarette smoking soothes them, and we're definitely gonna touch on that because it actually is true. It is true that people are a little bit more relaxed when they smoke cigarettes, but it's because of the chemicals that are in there. It's definitely something that we know. Causes problems, but it's just like any other drug. Once your body doesn't have enough of it, it starts to crave it. So of course, if you give what your body's craving, then it relaxes. So that's where that soothing sensation comes from. Jose, thank you for joining the video. We're talking about cigarette smoking and heart disease today. We talked about with cigarette smoking, we know plaque buildup in the heart, and when plaque builds up in the heart, we talk about heart attacks. And when plaque builds up in the heart, we talk about your heart going into heart failure. I think I talked about it in like episode 8. When plaque builds up in the heart, it can cause an irregular rhythm as well, which can cause problems and have you end up in the hospital for myelinations as well. But when we also talk about the heart disease and cigarette smoking, when plaque builds up in our arteries in our head, when plaque builds up in our arteries in our legs, when plaque builds up in our arteries in the kidneys, that can cause damage as well. The way I like to think about it, a heart attack is a blockage in the heart, but a stroke is a blockage in the brain. Kidney failure, some patients go through kidney failure because they're smoking. That's because of all those blockages that end up there from the cigarette smoking. If anyone knows anyone who may have like a long arm or a leg amputated, we know that also can be a cause to a lot of plaque buildup, which we know cigarette smoking plays a huge factor in that as well. So it's definitely a lot of things that, cigarette smoking, it's almost easier to name the stuff that cigarette smoking does not affect in our body than it actually does, because it unfortunately negatively affects almost everything in that regard. So who's more likely to, who are smokers now? We know that men are more likely to smoke than women, just from a percentage standpoint. And we know that as from an age standpoint, we know that ages between about 25 to like 45, 46, depending on the CDC numbers, that group of populates are more likely to smoke as well. We know that you tend to smoke at an earlier age because the reason why we know is because we know the tobacco companies spend billions of dollars a year advertising to, just advertisements in tobacco. And it wasn't until, they actually had to make laws that say, hey, you can't advertise to kids, that they stopped doing that. Unfortunately, they still do it, outside of this country. And just think about a sheer number standpoint, the number of people who smoke cigarettes in China, are much more higher than the population in the United States, just to give you an idea of how many people are still smoking around the world. So we know that, as you get older, you're least likelier to smoke cigarettes. And honestly, the reason I think that is because by the time you get older, all of that smoking that you were doing when you're 18, 20, 21, 25 has caught up to you. So now all of a sudden, you're having trouble breathing. You've been diagnosed with cancer. Something's happened that's said all right, now I got to stop smoking cigarettes. So usually it's and that's in my patient practice, my patient population that I've dealt with, that's usually a very common reason why, someone stops smoking. Not really because, and they want to, not that they don't want to, they want to. But usually it's some huge event, like they had a heart attack, they had a stroke, they had somebody in the family had a heart attack, somebody in the family passed away suddenly from smoking, someone had cancer. That's usually the wake up call that they get from the cigarette smoking. But a lot of times it's not, necessarily something that's going to happen at an early age. Why? Because, and I talked about it when I talked about the flu. The younger population, thinks they're very invincible. And I say younger population. I'm in the age group, right? I'm talking like I'm old, but I'm in the age group where we tend to feel that medical problems don't bother us. So we don't do anything about it. And so, we smoke, we do all these, crazy things. We do all these crazy things to our bodies that, catches up to us once we hit 50, 60, 70 years old. I got a question from Gino yesterday regarding vaping, right? Because that's becoming very popular, in our country, just being very popular in general. And, some of the, the do's and don'ts and, should I vape? Should I smoke cigarettes? And now from a safety standpoint, we know that those who do the vaping or the electronic cigarettes, we know that is safer than if you were smoking cigarettes. Again, if you you held a gun to my head and said, which one do I got to do? I'm going to tell you to do the vaping because we know it is safer. The numbers are different as far as how much safer. Some people say 50%, some people say 80%, some people are like 95. 95 is probably a little bit too high. But we know it is safer, and reason being is that a lot of the chemicals that you tend to have to inhale when you're smoking a cigarette, you don't do with the electronic cigarette. So that's where that benefit comes into play. But it still has chemicals in and of itself. Again, I read, just depending on where you read at, smoking a cigarette sometimes has over 4,000 different chemicals in it. And so if I could, I should have copied the list. The list of it is just oh my god, I can't believe all of that is smoking cigarettes. But people still do it, and and the big aspect of it is because of the nicotine. The nicotine is really the Trojan horse of it all. They're not really smoking cigarettes because all of the thousands of chemicals that are in cigarettes. They're smoking cigarettes because our bodies want that nicotine that's in that cigarette smoking, and when we go without it after, and some people who they have to smoke every lunch break, 2-3 times a day. So we know that. Once our body starts to craving something, just like when it, if it craves opioids, Xanaxes, all those, it's the same thing with the cigarettes. So that's where they get that soothing sensation, I feel good now that I'm finished smoking my cigarette until the next time, the next cigarette break, from that standpoint there. So what tends to happen from just from a clinical standpoint, when we talk about the vaping, the reason why I think vaping is becoming more popular is when you tend to have less of the secondhand smoking side effects that come from it. You tend to have, we already talked about less chemicals. There's the smell factor isn't there versus those who have it. The smell factor. Now, cigars tend to have just as much from a chemical standpoint, but theirs tend to be much more good. Because usually, again, remember, our cigarettes are very thin from a cigarette standpoint. But imagine you having to smoke 3 or 4 cigarettes at the same time. That's sometimes the amount of chemicals and nicotine that kind of comes into those cigars. So that's where that plays in a role as far as like this cigar smoking, because you get such a huge amount at once versus the cigarette smoking, where you may not get as much, but you may get as much over time. For the cigar question, Amanda. In that regard. Now, let me see. Now, I'm not sure if there's a difference between smoking the cigar and smoking it from a pipe. I'd have to look that up. And what I'll do when I write the blog post tomorrow, I'll make sure I have a caveat as far as like cigar smoking versus smoking in pipe, just to kind of see, if there's any like drastic difference from that standpoint there. So, again, we talked about, cigarette smoking. We talked about, who's affected, especially from a clinical standpoint. We talked about, sorry about that. We talked about who's more likely to be smoking cigarettes, especially in this day and age. And, and that question I always ask is, well, why would anyone, at a younger age still be even thinking about smoking cigarettes? Like, it's like with the amount of information that we have out there, that we know that cigarettes are such a problem, the fact that people still do it like just boggles my mind. Again, you guys know me, right? I'm not paid by the marijuana company, but like, if you said, Doc, what would you rather do? I'm telling you, go smoke marijuana, right? Don't smoke cigarettes, right? Like, and my patients who come to my office, they know, like, the second I read tobacco use, my next question is, all right, when are you gonna quit? When are you going to quit? What can I do to help you quit? Because it's just, in this stage and age, we do not need to continue to be smoking cigarettes. It's just, there's so many better things, so many safer things as well, too, right? So, it's definitely one of those, caveats that, that I kind of cringe when I see, especially my younger folks. Like, I understand if you're 50, 60, you're still smoking cigarettes, and it's because you were smoking when you're young, and it's just kind of continued along, because we know the studies show that the older you are, the more likelier you want to quit. Hey Maria, thank you for joining. We know you're more likelier to quit smoking cigarettes, and you're more likely to take the recommendation from your doctor as far as how you can quit. And lots of ways to quit. Now we have gum. We have patches. We have there's medications as well to kind of help decrease the craving. So we definitely have treatment options to get you to stop the smoking. It's just a matter of getting you to there. It's just a matter of getting you to the point where you want to quit cigarette smoking. So again, thank you guys for, this is Heart Disease Awareness Month, so I wanted to make sure I kind of curtail all of my, lunch and learns to kind of, get the word out on heart disease. Today we talked about cigarette smoking. If you could take one thing away from cigarette smoking, my cigarette lecture today is stop smoking cigarettes. Like, please stop smoking cigarettes. If you're smoking cigarettes now, you got plenty of options out there. You've got gum, you've got patches, you've got medications. Talk to your doctor, talk to your counselor, talk to your pharmacist, talk to somebody to get you off these cigarettes, because we know, like I said, especially my young folks who are watching this, who are invincible, the 25 to 44-year-olds, we know that it's not going to cause any problems now, but it will. All right. And then for the men, especially the men, this always gets the men. Like, men smoking cigarettes causes erectile dysfunction issues, right? So if you ever need another reason why to stop smoking cigarettes, it can cause ED, and you don't want ED, right? So I know you don't want an ED, so stop smoking cigarettes. Like, let's do both of our bodies good from that standpoint there. I'm gonna be talking about I will talk about secondhand smoking effects in the post tomorrow, but it is there. It is there. So just because you're not the one who smokes, if you got a partner who does smoke, problems will arise.
Thank you for listening to this episode of The Lunch and Learn with Dr. Barry. If you want to find out more about the episode, please go to www.lunchlearnpod.com. That's www.lunchlearnpod.com for the show notes and any links that may have been mentioned in today's episode. If you're interested in joining the Lunch Learn Pod community, head over to either the website lunchlearnpod.com or join us on Facebook and Twitter with the same username, LunchLearnPod. And again, you can find all of these links on the website. If you have any questions, any comments, or any requests for topics to, debut on the show, please let that be known. And don't forget to use the hashtag LunchLearnPod when you're listening to the episode. Again, I want to thank you for taking the time to listen to today's episode, and I'll see you next week.